As a nurse educator, we bring our real life experiences into the classroom. This is what helps us be a better nurse educator. However, it's not enough just for us to talk about our lived experiences. We have to go to the literature, we have to go to the evidence. Billings and Halstead, sixth edition, is what we use on the journey to help ensure what we're actually doing in the classroom, in the SIM, in the clinical area, in the skills lab aligns with the evidence. Competency one across the CNE PV, that's the new certification. If you haven't heard, that's the specific one the NLN has developed for nurse educator colleagues that teach in the practical and vocational programs. We know that our LPNs and LVNs are essential partners on the healthcare team. And also, if you're on the journey to CNE Clinical, CNE Novice, and CNE, all of these exams focused on competency of facilitation of learning. So, what does that mean? It's our ability to be a really good teacher. When we teach, we get to learn twice. We get to learn, have this deeper comprehension of concepts when we're actually reading the content for ourselves in our textbooks. The second part of this learning journey allows us to actually learn how to transfer the knowledge to our students. David Cope, experiential learning theory, talks about exactly that. We don't enter this learning journey, these four phases he talks about, until we have hands-on experiences, until we have iterations, which is just a fancy word for repeating these experiences over and over again. Okay, so that's what we're talking about in this snapshot. How do we engage on this learning journey in a way that's going to not only help us achieve success on the CNE exam, but also help us become a better nurse educator? So, welcome back, everybody. I'm Dr. Sellars. Our mission here at Dr. Sellars Educate is to support all nurse educators, all nurse colleagues on this journey to achieve certification. And listen, we know it can be challenging, it can be expensive, and it can be very time consuming. So, we're going to start out by asking you a question. Okay, so simply asking you, what is your largest gap area? All right, so go ahead and put in the chat for us, what is your largest gap area related to this certification exam journey that you're on? And tell us which one you're on as well. Is it CNE? Is it CNML? Is it CNEPV, the new one that we're excited to support colleagues across the country that are on that journey? We now have a self-paced course, so we're excited about that, or we soon will. It's going to be released over the next week. So make sure if you're interested in the CNEPV, make sure you sign up. All right. And then we want you to go ahead and go to the NLN website. Okay. We're going to go there with you. We want you to go to the NLN website and we want you to print out whichever exam you're going to take. Okay. So for those colleagues that are not on the journey to CNE, just stay with us for a second, share this with your colleagues. All right. Every single certification exam has a blueprint. That's for the CNML, that's for the CHESI as well. I forgot to mention that one. They all have a blueprint because these professional organizations practice what they preach. In nursing, it's best practice to have a blueprint. It's a guideline to help us identify and really focus which concepts we should spend time reviewing. Okay, so you see on the screen, this is an example, or this is the actual CNE blueprint. And then you see the detailed test blueprint. This is the tool that you're going to use to do a self-assessment. Where are you related to your knowledge for each of these subcompetency statements? We want you to be at 70 to 80%. If you're not there, it means it's a gap area, right? Which is okay. You're just going to put an asterisk, highlight it because it's a gap area and it's a pre-assessment. By the time you finish your journey, you would have already mastered the skills, have the knowledge you need to close your knowledge gaps. Okay. So let's go ahead and take a look at this thought-provoking question and let's see what you think. Because we are supporting our colleagues on this LPN, LVN journey, we have developed one specific or a couple of different questions related to the LPN, but you could fill in the blank with a faculty member. Okay, so a nursing faculty member notices that learners can perform skills correctly in isolation, but struggle to apply them during integrated patient care scenarios. Which instructional strategy best supports transfer of learning? A, increase repetition of individual psychomotor skills in the lab. B, embed skills within unfolding case studies requiring prioritization. Or C, assign additional readings on pathophysiology before skills checkoffs. All right, feel free to pause here if you want to take some time to process the information. All right, but we're going to keep going, and we want you to write down the rationale for the correct answers and the incorrect answers because that's important too. If you chose B, you are correct. Embed skills within unfolding case studies during prioritization. This aligns with competency one, facilitate learning. The rationale is that our goal is to integrate skills into contextual, which is just a fancy word that really brings the concept. Let's just use an example: care of the myocardial infarction patient. So, myocardial infarction or MI, care of that patient. We teach obviously concepts that the nursing student needs to know about in the didactic setting, right? However, it's situational learning that happens whenever we're able to actually share an example, a scenario when students have to prioritize the care, okay? When they actually have to apply the knowledge that they have learned about in the didactic setting. So that's all contextual means. We're taking the concepts and we're bringing it to life, okay, in a real life situation following the situational learning theory. So, integrating skills into contextual unfolding scenarios promotes clinical reasoning and application, which is essential for practice readiness. Now, let's go back. Let's talk about why the others are not correct. So, increasing repetition of individual psychomotor skills in the lab. Could that be helpful? It could be. Two thoughts we want to have for every question on the exam. What is the question really asking me, and what is it that I know for sure? Okay. So, when you think about increased repetition, does that really answer the question, which is about an instructional strategy? So, how am I, as the facilitator, supporting this transference of knowledge? That's really not getting to the core of the question. It really doesn't quite align. And then C, additional readings. Well, we know there's no evidence to say if we assign more, students are going to learn more. In fact, it's the opposite. We're increasing their cognitive overload, especially if we're seeking additional reading assignments to provide clarity, right? It can't independently. We have to take a collaborative approach where we are working with our students to help them clarify their muddy points. So this is why B is going to be your best answer. And if you didn't get that answer correct, we don't want you to stress out about it. Just know that's a muddy point for you, and you want to think about how you're going to close that knowledge gap as you move forward. You're going to use pages 188 through 190 as it relates to the cognitive learning domain. Okay, so that's where you're going to start. And then you're actually going to turn, and we're again in the sixth edition, but we have the crosswalk right here in the description where you can go and take a deeper look and alignment with the seventh edition, okay, if that's the one that you have. So for going deeper into teaching strategies, we want you to turn with us to chapter 16. Okay, so chapter 16 is going to identify some teaching strategies that will help you go deeper as it relates to our engagement of teaching in the learning experiences with our students. Again, I'm going to say the engagement in the teaching or learning journey with our students. It's a partnership. We want to partner with our students to help ensure that they are closing their knowledge gaps. When students don't close their knowledge gaps, they're not able to scaffold their learning. They can't build on prior learning because they don't have the solid foundation. Okay, so let's just take as one example, let's take a look at role play. I was going to say flipped classroom, but we talk about that one a lot. So let's talk about role play. So on page 293, role playing is a dramatic approach in which individuals assume the roles of others. It may be scripted, unscripted, spontaneous, or semi-structured interactions that are observed by others for analysis and interpretation of learning outcomes. This strategy can be used in class or online. So think about, I want you to take a minute to reflect, right? Because we want to use reflective practice also in our teaching strategy. So I want you all to reflect on role playing. Think about the last time you used role playing or scenarios in your classroom. How did it go? Did it go well? Did it not go well? All right. And this is what I want you to consider the next time you use role playing. Ask students to work in small groups and to develop the role play for themselves. What you want to do first, though, is make sure you have an outline. Make sure you're specific with instructions of how they can develop the role plays, maybe a little bit of a framework for role plays. Page 293 is going to give you a good explanation, going deeper, right? We just touched the surface of how role plays can truly leverage the learning experiences that students are having and also engage them on that learning journey. All right, and then the last tip that we want to share, or the last points that we want to make, are related to how we facilitate this learning that we're talking about. What is the role of the educator? How can we effectively make sure that we are aligning our teaching strategies with what the evidence is saying? All right, so let's talk about a couple of those strategies. Okay, so first and foremost, we want to teach didactic and skill-based content aligned with the LVN, LPN, or RN role. What does that mean? Well, when we look at our curriculum, we know that, as an example, teaching in a med-surg course, there's lots of concepts that we teach, no matter what the role is in our nursing program, where our ability to truly have alignment starts with looking at our textbook, right? That's the didactic part. And we have the skills part because there's also policies that align with current literature that says what the impact is when we follow the practice guidelines or when we deviate. Okay, so this is that skill-based content that we have to make sure we explore to align and map our assignments, which is the next point. We want to identify the desired learner outcomes by mapping assignments to the reading and to the learning objectives. I'm going to say that again. Ensuring that we're mapping our assignments and the reading that is assigned to our learning objectives and our learner outcomes. Okay, I'm going to close the loop on that in a second, but I want to make this third bullet point. We also want to use evidence-based teaching strategies such as simulations, case studies, role playing to make sure we're effectively integrating all of the elements of our curriculum to support student learning. And what happens when we don't do that? We see NCLEX pass rates drop, we see LPN, LVN pass rates drop, and we also see student satisfaction decline. So, what are some teaching strategies? What are some strategies we can use to prevent that from happening? Number one is going to be Socratic questioning. Let's find out from our students early what they know and they don't know. Our ability to truly engage as a partner with our students on this learning journey requires us to do something different. It requires us to think about the student first. It requires us to also create more formative assessments so students, first of all, are aware of their knowledge gaps, and then we in turn can work more closely to help them close those knowledge gaps. We hope the snapshot has been helpful. Make sure that you connect with us on our YouTube channel consistently every week. This is where we show up to go deeper in the comprehension of knowledge. Now, we know that we have more than 245 episodes or snapshots now, so we want you to use our playlist. Okay, there's a link to the playlist that we're aligning with, which is facilitation of learning in this snapshot. All right. Email us if you have questions, info@drsellarseducate.com. We look forward to seeing you in our next snapshot. Have a great one, everybody.